All right. Now, when I was a little kid, there was a day I was feeling particularly ornery, and I was messing with my sister over and over and over. And she warned me to stop. She was much bigger and stronger than me at the time, and she went ahead and punched me in the face. Now, while getting punched in the face is a great mechanism for keeping us safe from future dangers, like messing with your older sister, it is also a great mechanism for keeping us stuck. And type 2 diabetes has punched us in the face as a country. Now, while a global problem is going to take global work, what do we need to understand here in Kansas to do our part? Well, according to the American Diabetes Association, over 200,000 people already have type 2 diabetes, and over 700,000 people have prediabetes. Now, the CDC has identified 10 accredited diabetes prevention programs in the state of Kansas, 6 of them being in either Wichita or Kansas City. So that leaves a lot of room for very underserved communities in our state where people are not having access to proven curriculums that drive results. So for a big problem, we need big technology. But what do we know about technology that's successful? Because the one thing we do know, there's a lot of health apps out there, very tailored to the fitness community, people who are self-driven, that are not proving results for the people who need it most. Well, the first thing is we're going to need a community behind it. And Facebook and Twitter, as everybody knows, has done an excellent job of building a community that keeps people coming back, engaging, and communicating, mostly because people love keeping up with the Joneses, so they need to post the best things happening to them. Diabetes Connect has also created a powerful community, so powerful, in fact, that people go to Diabetes Connect and get information from other diabetics and take that information over what their physician has told them. An amazing community. If you haven't checked them out, give them a look. We know the tool must be easy to use. User-friendliness is key. Now, Fit Men Cook and FitStar have both done an amazing job at creating user-friendly technology. Fit Men Cook is one I've actually in the past used for my own nutrition clients. It allows you to find quick recipes, build a meal plan, and automatically have a grocery list in your pocket that you can check off on your phone while you're in the store. FitStar is also very user-friendly, brings the video right to your phone or tablet or television, and creates your workout plan for you, powered by powerful technology, and it actually improves the workouts as you progress throughout the program. They're so easy to use, that's probably why they have over 5 million users currently. The educational aspect must be entertaining. Quick example, when I was in high school, I took 3 history classes and listened to absolutely 0 of the lessons given and did very little of the homework as well. When I found Crash Course on YouTube, I watched all 102 episodes of the world history, not only because I kind of wanted to know what was going on in the past, but because they were so entertaining. They bring entertainment to education. These are 3 YouTube channels that have gathered over almost 20 million subscribers, and they keep people engaged with education. The education aspect of the platform must be very entertaining. Now, why is the education important? Well, I'm not going to read this entire paragraph for you, but in a study with 2,500 patients, 42% misunderstood the directions, 25% misunderstood the scheduling, and 60% were unable to comprehend the medical information. That makes it tough to create interventions for people if they have no idea what is going on. Nudges play a key role as well. Sense Health, which is an amazing company, actually has clinical research behind nudges. They have an automatic communication system that proved results for the end user. We decided to put it to the test in our program, and if you notice, both of those messages say 6:30 a.m. because they're sent off by my computer, and both of them got a response from the client. How powerful of a response? Well, as you see from the top message, the people we're working with are waking up with negative mindsets, and a simple nudge from a powerful coach can make a world of difference. This isn't my dialogue going into these nudges. It's from the greatest people in America today. Dr. Kelly McGonigal, the late Coach John Wooden, the guy who actually wrote the book, The End of Diabetes, Dr. Joel Fuhrman, and the leader in neuroscience and happiness, Dr. Amit Sood. Automation is key. If we want to serve 700,000 pre-diabetics, there's got to be some automation involved, not only with the communication system, but also with gathering the data and sharing that data. IBM Watson Health Cloud has made that available for early on technologies like our own. It makes it easy to build upon and develop a system that's not only HIPAA compliant, but very powerful and was previously only accessible to very large organizations. Affordability also plays a key role. Two of the companies that have proven we can take the diabetes prevention service and move it online are Omada Health and Retrofit. Now, I used to be a huge fan of Omada Health until a very reliable source told me not to be and to go in a different direction. $130 a month and $200 a month is not what we're looking for if we're trying to help as many people as possible. So that brings us to the King Fit Hub for health and wellness. Now, as much as I nagged the graphic designer putting together our user interface, she was just not able to get it done in 2 days. So we got to give her a little bit more time, and I decided to paint the picture with other pictures. First page on the new platform is the community page, bringing the power of community not only where diabetics can connect to each other, but where the end user can connect to the physicians, where they can connect to chiropractors, physical therapists, understand what events are going on in their community based on their GPS on their phone, understand where is going to be the best location for them to buy their groceries, and where are the areas where they can exercise with people who are in similar statuses as their own. The data page is next, and as most of us have on fancy wearables, everybody likes to see their graphs go and change and move. We want to bring the data to the second page where people can integrate their current wearables and their current applications and see it all in real time. The third page involves the regimen. Taking from Fit Men Cook and Fit Star, we're bringing together the exercise and the nutrition tools to allow people to work out at their own convenience, work out on programs that are tailored to their specific needs, build their grocery list, have their meal prep videos, and meal plan all in one area. And the last page of the platform is the modules section, where we will bring the diabetes prevention program in an entertaining fashion to the people who need to follow the curriculum to create the long-term change for themselves. Now, while this may not be the complete answer to fighting type 2 diabetes in the state of Kansas, it is going to be a very strong right hook. Thank you.
How much?
We are going to be offering it for less than $5 a month.
Is there any particular reason you're restricting it to the state of Kansas?
We will be going nationally and hopefully globally as well. Being from Kansas, this is where we're going to go ahead and start coming to market.
CDC recognition?
We are pending approval. It takes a year to get the approval. So we've already submitted our information and we're under pending approval.
Is that me now? Oh, just a comment. A few years ago when I was working with neurofeedback and wanting to enhance learning, I was trying to target underprivileged kids. And the mayor suggested I go over to the Boys and Girls Club. And they really liked it. They didn't have funding at that time. However, the Boys and Girls Club here is really a national model. It got really well funded. You know, it didn't take mine at that time, but they have a lot of fun donors that are really supporting them. And if you don't already have a site to get initiated with, that'd probably be great.
Thank you. Thank you very much.
Most welcome.
How are you going to reach the low-income population that probably needs this the most?
Yes. Well, we plan to come in 2 tiers. One, through physicians, if we can work with some clinical research and hopefully get the platform FDA approved, we'll go through physician prescription. But another tier is thanks to Google and Facebook, we can land right on their desktop and sell to them commercially. Thank you.